how to get rid of snoring. 7 tips from a dentist. Watch this video to the end and you will get a completely free book on how to treat snoring and obstructive sleep apnea syndrome. I will tell you how you can download it in portable document format. Snoring. How much is in this word, like in poetry, right? It has merged for the Russian heart. But not only for the Russian heart, but also in general, 30% of adults snore, and at least half of them listen to this snore. And snoring as a sound can interfere with social life. And there is a statistic that in England, 10% of divorces are related to a partner's snoring in bed. But snoring can be a symptom of a serious illness called obstructive sleep apnea or sleep apnea syndrome. The thing is that our throat is a muscular tube where all the walls are movable. When we swallow, it collapses, and when we breathe, it opens. And if there are factors that contribute to the narrowing of the airways, the most common one is simple obesity. We even have an epidemic or even a pandemic of obesity. So the airways become narrower, a person falls asleep, the muscle tone decreases, the mobility of the walls increases, and such a phenomenon occurs. That is, the airways are completely blocked, and there is an episode of suffocation, essentially a cessation of breathing associated with the collapse of the airways at the level of the throat. To be continued. The second is large tonsils, a retracted lower jaw, problems with nasal breathing, reduced thyroid function. Well, that is, there are various reasons for snoring. And I probably will even start, as they say, we all come from childhood and diseases are also from childhood. Children also snore. At 7 years old, approximately 15% of children snore, and approximately 2% of children have obstructive sleep apnea syndrome. And this can be noted by parents who themselves snored or snore, or who have snoring children. Well, as doctors, unfortunately not always understanding the consequences of snoring, they say, well, wait, the child will outgrow it, his tonsils will decrease, his adenoids will decrease, and indeed this will be the case by the age of 18. But what can happen? Literally about a year ago, a mother comes to me, says the child is snoring, has sleep apnea. In 3 years, he practically stopped talking. He started to lose weight. Even though a child should grow and gain body mass, he has enuresis, he has, of course, snoring, sleep apnea, he has expressed lethargy. He is not doing well in school. Well, at 3 years old, he is not yet studying, but somehow he is developing poorly. That is, he is growing up mentally limited, especially if he has practically stopped talking. And the doctors, looking at all this, say, well, wait, let's wait and he will outgrow it. So naturally, I tell mom, dear mom, mommy, not very good to say mommy, mom, right? Let's do a polysomnography. The child undergoes polysomnography with 144 breathing stops per hour. Normally, children have up to 1 stop per hour. Mild apnea ranges from 1 to 5, from 5 to 15 is moderate, above 15 is severe per hour. And the child has 144 stops per hour. The minimum oxygen saturation in the blood is 58, which is already life-threatening. It's practically incompatible with life. And they tell the child, let's wait until adulthood. And why such symptoms? It's understandable that the child's sleep is disrupted and the child's sleep is responsible for physical and mental development. The production of growth hormone occurring in deep sleep stages decreases, and such stages are virtually non-existent. And this child grows and develops poorly physically. In adults, symptoms vary slightly. This is so that you suspect yourself If you or your close ones have such a situation, this is a loud interrupted snoring. This is an indication of a stop in breathing during sleep. That is a pause, inhalation, pause, inhalation. This is superficial, restless, non-refreshing sleep. This is night and morning arterial hypertension, frequent urination, 2, 3, 4 times a night, practically with a full bladder, morning and night headaches, night sweats. The upper part of the body and the head predominantly lose heat. The man says his pillow is wet. And this is severe daytime sleepiness. Moreover, it's also a disruption of metabolism, decreased testosterone production in adults, decreased libido, poor sleep, decreased potency. In general, alas, this ultimately leads to impotence in men. Such serious consequences of snoring and sleep apnea in children and adults. Hence, it's crucial to first suspect, then accurately diagnose, and finally handle this situation. Moreover, there are already such serious medical approaches. Maybe we will talk about them in the end. But there are simple enough tips that a person can apply at home and generally eliminate snoring and maybe even significantly alleviate apnea. So, 7 simple ways that you can apply yourself at home to deal with snoring and even sleep apnea without turning to doctors. First, lose weight. I said at the very beginning that the main cause of sleep apnea and snoring is excessive body mass. Usually there is such a simple rule. Remember how much you weighed before you started snoring. Usually I always ask patients such a question. I weighed 154 pounds. And how much now? Now it's 80. So reduce your body mass exactly to the level it was before the snoring, and the snoring will disappear. Although, of course, it's probably very difficult for a person weighing 308 pounds who used to weigh 70 to lose weight down to 70. But that might be a separate task. But if you, for example, recently started snoring and since the onset of snoring gained 3, 4, 11 pounds, I want to say that it's quite a solvable task to lose, again, those 3, 4, 11 pounds. Moreover, if you recently gained body weight, that is, if it has been consistently high for over 5 years, then you need to consult dietitians, endocrinologists, and so on. If you have relatives who snore and the loudness of the snore is comparable to a sledgehammer, give a like. The second method. This is what is called positional treatment. Sometimes a person snores on their back, but not on their side. Or a person has breathing stops in sleep and sleep apnea on their back, but not on their side. In other words, the simplest method is to take a t-shirt or nightgown, sew a pocket on the back between the shoulder blades, and put a tennis ball in it. And in fact, turning onto your back becomes impossible. This beautifully replaces the elbow of a neighbor who is constantly poking there and saying, turn on your side. But overall, after a month, a conditioned reflex is formed not to sleep on your back, and the situation is resolved. This, of course, does not cure in the sense that we do not eliminate snoring, but it really helps to cope with the problem while a person is sleeping on his side. At the same time, paying attention, we already talked about weight, that if you continue to gain weight, then in the end, the positional advantage is lost, and you will start snoring, or you will have apnea in any body position. Therefore, it is still a wake-up call that other actions need to be taken in order to reduce snoring and apnea. Snoring leads to trauma of the respiratory tract because it is a constant vibration and beating of them against each other. And the soft palate that we have, even if we look at our own throat, there is a visible uvula hanging. It constantly beats against the walls of the respiratory tract, loses its tone, sags, and this further intensifies the snoring. But there is training for the muscles of the soft palate, tongue, and lower jaw, which can alleviate or eliminate snoring. And in this book, I want to show this training is directly provided. Remember, I said that at the end you will be able to get a link to this book, download it completely for free. So here are a few exercises from there. First, this is the extension of the tongue as far forward and down as if you want to reach the tip of your chin. In yoga, there's a lion pose where you extend your tongue fully and pronounce the high sound I. You may not get it right away, but it's good for training the soft palate. It trains the tongue muscles, moving the lower jaw forward. And if these muscles are toned, the tongue is slightly moved forward. The sky vibrates less, and the intensity of snoring decreases. And the second exercise is when you push the lower part of your hand back and move it forward. That's how it happens. That is, such a hand movement is pushed back. We are training the muscles of the lower jaw, also moving them forward. This leads to the fact that the same muscles are in tone, the lower jaw is shifted forward, and the front and back sides of the respiratory parts becomes wider. And over the course of a month, if you engage, the intensity of snoring or apnea can be reduced by approximately 30%, and if you generally had not a very complicated case or not very strong snoring, then you can completely get rid of snoring with the help of such exercises. The only thing is that this needs to be done regularly, because if you quit, the tone will decrease in a month and snoring will appear again. It's very important to create a hypoallergenic environment in the bedroom. The thing is that all these allergens that we breathe, they cause a swelling of the mucous membrane, especially if a person has some kind of allergy to household dust, mite, feces, mold, and so on. Nasal congestion is intensified. Nasal edema, that is, all the respiratory paths become edematous. They become already, the tone also decreases against the background of such an allergic inflammation, and this can cause and aggravate snoring and even aggravate apnea. Therefore, first of all, you need to remove everything, especially old feather pillows or some kind of cotton down jackets. The point is that all of this is a breeding ground for mites, domestic dust, which can cause allergies. Pillows need to be changed every 3 years without fail. I remember the old times. I lived in the city, but I remember that in winter people would take out their pillow clothes to freeze and in summer to sunbathe. Do you often see pillows lying in the courtyards now? They all rot at home. Take a pillow, put it in a polyethylene bag, a package, and put it in the freezer. In large freezers, -18 in modern refrigerators for days. And this very well disinfects this pillow because all this life there simply dies. Of course, it doesn't go anywhere, but gradually then, if you still shake this pillow, it will go away somehow. But once every 3 years, we definitely change the pillow. What's also important, especially if you have an allergy to dust mites or dust in general, is to use a mattress pad. Okay, you can change it, you can wash it, but you can't wash the entire mattress. The mattress pad has isolating ones. When you put it on the mattress, it isolates the mattress very well from our biological waste, and sweat doesn't seep in there and so on. There are fewer dust mites developing there, and what's more, you can remove and wash this mattress pad, thereby reducing such pollution of the environment. Next, there should be no vacuum cleaners in the bedroom. And what is that? These are books in open cabinets, these are some knickknacks, these are rugs. That is, there should be a bed in the bedroom and with clean laundered linen, new pillows, and so on. 2 bedside tables, a maximum closed wardrobe. Everything. No tapestries, no screens, no colors. Flowers, they give off oxygen. Maybe they do give off a bit of oxygen, but they also collect dust, especially if the flowers are as shaggy as any. And secondly, a huge amount of dust, dirt, spores, and all this is also thrown into the atmosphere from the ground, which we also breathe. Therefore, there should be no flowers in the bedroom either. Don't forget to wash the curtains at least once every 6 months, better every 3 months, because they also collect dust. Fifth, you need to create a normal humidity in the bedroom. In the heating season, our climate is close to continental and dry. And the heating season, for example, in the middle belt of Russia lasts half a year. It's cold, dry, and the heating further dries out the air. And in our apartments, humidity can drop to 20% relative humidity, which is the humidity in the Sahara Desert during the day, and naturally everything dries up, the skin dries up, women wake up, say I have a lot of wrinkles, and this is also the mucous membrane reacts in response to dryness with a runny nose, nasal congestion, a sore throat, and this can also cause and aggravate snoring. By the way, I want to say that sleep hygiene is an extremely important element of healthy sleep, and I in other videos say that we should fight stress. If we talk about insomnia, we should take some information detox, physical load, but we should also create a comfortable environment in the bedroom. And by the way, if you have stress, insomnia, in addition to snoring, I have a great mini book written just about how, first of all, to diagnose stress and insomnia in yourself, and secondly, how to effectively cope with it. In the description to this video, you can find a link to this remarkable book. Sixth, it is necessary to ensure normal nasal breathing. We've already talked about allergies, which can also cause nasal congestion and make it harder for a person to breathe through their nose. But we sometimes just have poor nasal breathing in response to, for example, some kind of respiratory diseases, overcooling. And this can also cause situational snoring and even stoppages in breathing during sleep. In this sense, you can simply use decongestants, as they are called, or vasoconstrictor drugs, which you drip into your nose, and accordingly, nasal breathing is facilitated, and a person snores significantly less. The only thing that's important to understand is that these vasoconstrictor drugs should not be used for more than 3 to 4 days in a row, because dependency can develop, and then if you don't use them, it gets even worse than it was at the beginning. In this sense, if after 4 to 5 days of using vasoconstrictor drugs, your nasal congestion has not passed, ideally, it's probably better to talk to your doctor, but the standard approach is to use local topical corticosteroids, which have anti-inflammatory and anti-allergic effects. Maybe I'll go to the ear, nose, and throat doctors again, and it would be a good recommendation to say, of course, see a doctor, but unfortunately, not everyone can get to an ear, nose, and throat and discuss all this with him right away. Therefore, the standard scheme is such: 4 or 5 days of vasoconstrictor drugs is not enough. At least another week is needed for local application of topical corticosteroids, which will reduce swelling and improve nasal breathing. And one more little life hack. There are special nasal strips. They are sticky and springy. They stick to the wings of the nose. They try to straighten up and spread the wings of the nose apart. A person starts to breathe better just by mechanically opening the nostrils. You can also perform this test yourself. Taken with your fingers like this near the wings of the nose, spread a little and breathe. If you really breathe better, then yes, you have a problem with the fact that a narrow passage in the nose and the opening of the wings of the nose will ease your nasal breathing. By the way, when I have some kind of respiratory infection, I prefer to, instead of dropping drops, stick this strip, and actually speaking, it improves nasal breathing. I don't even have to drop these drops. Write in the comments what causes your snoring. And I read the comments, maybe I will give you some advice on how to deal with this situation. Limit or stop alcohol consumption and quit smoking. Alcohol relaxes the throat muscles, and strong drinks also additionally cause mucus, which causes and exacerbates snoring. There are studies that show that if a person weighing 154 pounds consumes 7 ounces of vodka, well, the dose is decent, but it doubles the severity of snoring. This can even lead to some serious complications in the form of hypertensive crises, even heart attacks or strokes, or sudden death in sleep. This is also a described situation when patients with apnea consume large doses of alcohol. Smoking is a chemical trauma of the mucous membranes, and it also causes inflammation and edema, which also aggravates snoring with alcohol. Ideally, one should completely stop consuming alcohol, and this accordingly will reduce the likelihood of snoring. As for smoking, the situation is a bit more complicated here, especially for overweight people. If a person quits smoking, and they have been smoking for quite a long time, they can significantly gain weight. And remember, weight gain is one of the main causes of sleep apnea onset. Therefore, if you have an excessive body mass and you smoke, first you need to create a body mass deficit, preferably at least 10% to lose weight, and then quit smoking, because potentially you can gain this weight back. And what can be advised is to not smoke at least 2 hours before sleep, because there will be less tissue edema, and after the last cigarette, thoroughly rinse your throat with vegetable oil for about 30 to 40 seconds, and of course spit it out. The oil is quite good at washing off all possible toxins or some kind of soot and so on, settling on the respiratory paths and causing additional inflammation and swelling. As promised, at the end I'm showing this remarkable book again, How to Treat Snoring and Obstructive Sleep Apnea Syndrome. In the description to this video, I will provide a link where you can download it absolutely for free. Here are many more additional tips on how to deal with snoring yourself, but at the same time, Medical approaches to treating sleep apnea are described, and in general, after reading it, you will understand when it is already necessary to see a doctor because sleep apnea can be harmful to your health, to